I'm now going to show how to administer oxygen and how to use the portable oxygen tank. So you have the oxygen tank. You normally identify it on the color, and it normally has written oxygen on there, but on this, for training's purpose, it's written compressed air on there. You can also identify it by the 3 holes on there to put on the regulator. So that's the regulator. It has a dial to see how much pressure is in the tank. It has a dial to set up the flow rate. And in there is the Botox seal. So if the regulator leaks or if any air can escape, you might have to change the Botox seal. So always check that one. To assemble it, you put the regulator on the oxygen tank, matching the holes in there, and then tighten it. You want to have it tight enough, but not too tight. So once you have it tight, just turn it a little bit back so it's not too tight. You then want to see how much pressure is in there. So you turn it on, and this ball has a little bit under 1000 psi. Once you turn it off, you want to flush the lines. And it's important not to have a ball standing like that. You always want to have it lying somewhere. So in this case, I'm going to lie it under the stretcher. To administer oxygen, there are many different devices. So you can have the nasal prongs. See them? They're used to administer oxygen on a flow rate between 2 and 4 liters, and they have around 20 to 40% oxygen in the air. The next one is the acute mask. That's that one here. It's used to administer 6 to 8 liters at a percentage of 60%. Next device is a nebulizer mask. It's used to administer liquid drugs through the air, and it has to be set on a flow rate of 8 liters. It administers around 60% of oxygen. The next device is the high concentration mask. This is actually a pediatric one, but the adult one looks exactly the same, except it's a bit bigger. So you have to set it up to 10 liters, and it's administering 90% of oxygen. And once you put it on, you want to make sure that the reservoir is inflating and stays inflated. And the last device is the bag valve mask. You're using it with 10 to 15 liters, and it administers 98 to 100% of oxygen. As well, you want to make sure that the reservoir is filled. On this patient, I'm going to administer 8 liters of oxygen, and I'm going to use an acute mask for this. So again, you want to connect the acute mask to your regulator. You want to turn it on, set it on 8 liters, and then lie the oxygen tank down again. Again, you need to tell the patient that you're putting a mask on his face, even if they're unconscious. So I'm going to put on an oxygen mask on your face, if that's alright. So you want to face the mask on the face, place the mask on the face like that, and then you can tighten it on here, or with the metal clip on there. I'm now going to demonstrate how to use a bag valve mask. Use it either during CPR or to assist ventilation of an unconscious patient. Before you use it, or like at the start of every shift, you want to check if the bag valve mask is working. So you close it up here and just apply pressure to see if there are any leaks. Next one, you want to check the reservoir. Just the same, just pump up the reservoir and see if there are any leaks in there. After that, you just want to reassemble it so it's ready to use. Before using a bag valve mask, you want to insert an OPA. Same as last time. Measure it, insert it, tilt it 180 degrees, and put it in. On ventilating, you want to attach the bag valve mask to the oxygen, and you want to set it up to 10 to 15 liters. And you just want to make sure that the reservoir is filling. As I am a single user, I'm using a C grip and I want to apply a head tilt chin lift. And then on the ventilation I want to look for a good chest rise. So as you can see, there's a chest rise. You want to ventilate every 5 to 8 seconds. You want to avoid gastric inflation, and you can do that by getting a bystander to apply tricep pressure. Just apply pressure here, and it's closing down the esophagus. I'm now going to demonstrate how to use a suction unit to remove a foreign body or fluid of a patient's oropharynx. Before you use the suction unit, you want to test the suction unit. So for that, you turn it on, press the test button, and close down one of the tubes. The suction unit will automatically turn off after it reached the required pressure and the test is successful. So now the test is successful. Using a suction unit, you can either use a rigid catheter or a soft catheter. I'm going to use the rigid catheter, but you can't use a rigid catheter in a moving vehicle. Before you use the suction unit, you want to place the patient in lateral position. This can enable fluid to run out. You only want to suction on the way out, and you don't want to suction longer than 10 seconds. So you turn it on, you insert the rigid catheter only as far as you can see, close the hole, and then in a circular motion pull out and suction. The complications of using a suction are that it can induce vomiting, hypoxia, soft tissue damage, and laryngospasm. And it also can cause bradycardia due to stimulation of the vagal nerve. I'm now going to demonstrate how to secure an airway of a patient using an OPA. Indications of an OPA are if the patient has a GCS below 8. Contraindications are if the patient still has a gag reflex. And the complications are if you use the wrong size of an OPA, you can induce vomiting and you can damage the oropharynx. So to measure the size of an OPA, you want to place it from the corner of the mouth to the mandible. So as you can see, that's the right size. And before you want to insert it, you want to do a head tilt chin lift to open up the airway. You want to insert the airway, turn it 180 degrees and insert it the rest. I'm now going to secure an airway of a patient using an MPA. Indications of an MPA are if the patient has a GCS below 8 and if an OPA is inappropriate. Contraindications of an MPA are if the patient has a severe head injury or a base of skull fracture. Complications of an MPA are that it can induce bleeding and that that polyps might cause a resistance on inserting it. To measure the right size of an MPA, you hold it from the nose to the earlobe. So as you can see, that one is not long enough. So we'll try that one. And as you can see, that one is the right size. Before inserting it, you want to lubricate it. On inserting it, you just choose the bigger nostril and just gently put it in with a little bit of rotation until it's in all the way. If you encounter any resistance, you can try to rotate it a little bit, or you can try the other nostril. This is my LifePack 15 familiarization video. So that's a LifePack 15. On the right hand pouch, you got the 3 lead ECG cables, the SpO2 probe and the EtCO2 probe. On the left hand pouch, you have the defib pads, test load, the 12 lead cables. At the back of it, on the top one, you have the blood pressure cuffs and different sizes of blood pressure cuffs, and also a spare ECG paper roll. The same at the back, the more ECG dots and a few different sizes of blood pressure cuffs for pediatric patients. To check or change the batteries, you can open that here. In there are the batteries, so to check you can press the button and it will show you how much energy is left in there. To change it, just take them out, put a new one in. When you turn the LP15 on, it will automatically go to AED mode, so for the test purposes we want to change to manual mode, and we want to select 50 joules. So press on, press energy select, use the speed dial to rotate to manual mode, enter yes, and then select 50 joules. It's now on 50 joules. So at first you want to make a user test, so you go options, user test, and it's now making a user test. It will print out a piece of paper once it's finished. So the user test is now passed, and I want to carry on with the test shock. So for that I want to connect the cables to the test load. Just be aware that it's live energy. You then want to charge it to 50 joules, so as we set it on 50 joules before, I just press the charge button. It's now charging. To press shock, press the shock button. Now deliver the shock. You then want to charge it again. It's charging to 50 again. And to disarm a shock, just press the speed dial button. And the shock is now disarmed. On default, the monitor shows the pedals. To change that, press the lead button and choose the leads you want to see. So you can now see the leads. To change the amplitude of the leads, select them, go on size and change the size. Press the home screen button to go back. To change the QRS volume, go above the heart rate, press the speed dial and change the volume. Also press the home screen button to go back. To make a blood pressure, press the IPP button. Once you did that, you can choose to set up an interval for future blood pressures. So go on the blood pressure part of the monitor down here, and then you can set an interval between 60 or 2 minutes. To print off a piece of ECG, press the print button. Once you finish printing, just press the print button again and it will stop printing. To change the paper, open it up here, take the paper out, put a new one in, and close the lid again. If a lead should come off the patient, like that, the monitor will show a dotted line and it will write what lead came off. So just simply put it back on then. And it will now show the heart rhythm again. To change from manual mode to AED mode, simply press the analyze button and it will go back to AED
Connect
mode.
electrode.
I'm now going to show how to take vital signs. So I'm going to start with the heart rate. And first I have to ask for consent. So Manuel, is it okay if I take your heart rate?
Yes.
So I'm going to listen for 15 seconds. So his heart hit 22 heartbeats in those 15 seconds, and then I timed that by 4 to get the full minute. So that's 88. The next vital sign I'm going to measure is the blood pressure, and again I have to ask for consent first. So Manuel, is it okay if I take your blood pressure?
It's fine.
Perfect. So at first I want to remove any clothing above the arm. And I then want to place the blood pressure cuff on the arm. You want to make sure that the artery sign on the blood pressure cuff links up with the artery. You then place the stethoscope above the artery and inflate the cuff until you can't hear the heartbeat anymore, and then just give it another pump. So the first sound I hear is the systolic one, and the last one I hear is the diastolic one. Alright. So your blood pressure was 110 on 70. The next vital sign I'm going to measure is the respiratory rate. You normally don't want to tell your patient that you're taking a respiratory rate because it might change the result of it. So a good way of doing that is to ask if you can do the heart rate again. So Manuel, is it okay if I take your heart rate again?
That's fine.
Then I'm again listening and looking for 15 seconds. So Manuel took 4 breaths in those 15 seconds and now times it by 4 to get the full minute. So that's 16. So his respiratory rate is 16 and that's within the normal limits. I'm now going to listen to Manuel's lungs via auscultation. At first I have to ask for consent again and I might need to lift his shirt as well. So Manuel, is it okay if I listen to your lungs?
That's fine.
Perfect. So first I start on the top ones. Just take a deep breath for it, please. And I'm listening for any wheezes or crackles or any abnormal lung sounds. And then I'll do the same at the back. Okay. So your lung sounds were normal and there was no wheezing, no crackles. And I'm going to show how to do hemorrhage control. And first you want to expose the wound, so could you please show me your wound? Right. If necessary, you want to clean the wound using some saline. Just squirt it on and clean it, get some dust or some foreign particles out. You also always want to use the smallest possible dressing on the wound, so if you have a big one, just fold it up and that will increase the pressure on the wound. So you then place the dressing. And you can get your patient to hold it for the moment. Can you please hold it for that? Thank you. Then wanna put the bandage on to hold the dressing in place and to have enough pressure. Thank you. So on there, you can twist it twice to tighten it. Tape or just chuck it in on the side to secure the bandage. After you have a bandage, you want to make sure that it's not bleeding through it. If it should, you can apply another bandage on top. And you also want to check for a sensation and for a pulse. In case of a catastrophic bleeding, you want to use a tourniquet to stop the bleeding. You want to apply the tourniquet 10 centimeters proximal to the wound. Important that it's on there tight, and then you want to tighten it by turning it on here until the bleeding stops and you can't feel the distal pulse anymore. It is important that you put on the time of the application on there. If one tourniquet shouldn't be enough, you can apply a second one proximal to the first one. I'm now going to show how to immobilize a C-spine using a C-collar, like that one. To identify whether a patient needs the C-spine immobilized, you use the Nexus rules and the Canadian C-spine rules. So the Nexus rules state that the patient has midline posterior C-spine tenderness. So you identify it by feeling on the C-spine and asking the patient if there is some tenderness. It also says if the patient is intoxicated, has a altered mental status, and has neurological deficits in his limbs, so it's like pins and needles, or if he can't feel it. And he also, if the patient has a distracting injury, like a painful distracting injury, you want to immobilize the C-spine. The Canadian C-spine rule has various high-risk factors, such as high-speed crash or fall from heights. So before you want to put on the C-collar, you want to gain the consent and you want to inform the patient on the procedure you're going to do. And you also want to have a bystander holding the head during that time. To measure the C-collar, you use your fingers and measure from the clavicle to the chin. So that's around 3 fingers. You then place your fingers from the plastic part on here and match the holes on there. So that one I would use 3 holes. So I can just slide it, put it on the third one, and don't forget to lock it in. Before putting it on, you want to give it a good bend, so it makes it easier to put it on. After that, you want to slide it under the patient. Bend it in like that. You want to make sure that there are no hairs or if the earlobes get caught in there. You also have to make sure that it's a nice tight fit and that it's aligned in the middle. I'm now going to show how to do fracture management. It's important to figure out whether there really is a fracture. You can do that by gaining history and by using the plus disc X-ray. So, what happened to your hand?
I just fell over and it's been sore ever since. Really
okay,
sore.
so you just tripped on and fell.
Yeah.
Right. So I'm going to use plus disc to figure out whether you have a fracture. So first, what's your pain score out of 10? 10 being the worst you ever felt?
I'd say it's a good solid 7.
Good solid 7, okay. So next I want to look for any loss of function, unusual movements, swelling, irregularity, shortening, not especially in here, just if it's like a femur head, and a crevice, and in case of long bone fractures, a shock. So can you still move your arm? Can you wiggle your fingers? And
It's really sore when I try to move.
oh yeah, okay. And you can see there's a little bit of swelling on there as well. Just wanna check for your pulse. Oh yeah. Can you feel my fingers?
Yep.
I'll do that as well on the other side. Can you feel that as well?
Yeah.
Yeah, and compare the colors as well. Before I start splinting, I want to sort out the pain relief, as moving the limb will be quite painful. So I think methoxyfluorine would be a perfect pain relief for this patient, as it's an inhaled analgesic and it has a fast onset time. And clearly this patient is able to obey commands. Before that, I have to sort out whether there are any contraindications, and I also have to do a drug check. So, have you had methoxyfluorine before?
No.
No. Do you have a family history of malignant hypothermia?
No.
Do you have any renal impairment?
No.
Do you have any known allergies against it?
No.
Next, I want to do the drug check. So I want to check if the right patient, right drug, right dose, right route, and the right time. So normally I would get my bystander to cross-check it with me, but in this case I'll show my patient the drug I'm about to administer. So as you can see, it's methoxyfluorine.
Yeah.
It's used by ladies until 2018.
Yeah.
And it's 3 milligrams of methoxyfluorine.
It is.
The dose for an adult is 3 milliliters, and he can get a second dose of another 3 millimeters, adding up to a total of 6 milliliters. Preparing it, you open it, pour it in there, just rotating, put it away. So I want you to suck on here,
Yeah.
and it's important that you breathe in and out through the green whistle.
Okay.
If you want to have it stronger, there's a small hole in there under your finger, you can close that one and that makes it stronger.
Okay. Thank you.
Next I want to sort out the splinting. So I need a cover splint, a towel, a bandage, and the triangle bandage. So I want to place the towel into the cover splint just to make it more comfortable. And then I also want to place the bandage underneath it, so it's just easier to work with. Okay, I'm gonna need you to put your arm in here. I can assist you if you need.
Yeah.
Help.
Okay.
So just gently lift it, place it in there, and then we just gently wrap the bandage around it. Just keep breathing through there to get your pain relief sorted. I want to check the cardiovascular and neurological integrity of both limbs. So just feel for the radial pulse again. I can feel it. Can you still feel what I'm doing with your fingers? Yeah. Check for a cap refill time. So it's under 1 second. That's good. And I want to place the triangular bandage so it's easier for the patient to rest his arm. After sorting the splinting out, you then can administer further pain relief in form of paracetamol and ibuprofen, and that's more for getting the long-term pain relief started. On approaching a scene, I want to check for dangers and just make sure it's secure for us to work in there. So I want to smell for gases, look for any leads, look for bystanders or moving vehicles on the scene. So this scene is safe and we can now approach the patient. Hello sir, can you hear me? Ambulance? Not responding to voice. Pain stimulus? Not responding to pain. Airway looks clear. It's not breathing. Can you start CPR?
Analyzing heart rhythm.
Don't touch the patient.
Do not touch the patient.
Gonna prepare the airway.
Start CPR.
We start CPR again. Gonna insert an OK measure. So that's that. I'm gonna set the oxygen to 15 liters. Right. Tell me when you're 27.
26, 27, 28, 29, 30.
Looking for a chest rise, so it's good chest rise. Carry on. Comes from AHE1. We've got an R49 requesting an R50. Has anyone seen the patient collapse? No bystanders have any information. My suction unit is ready. If I should need it.
27, 28, 29, 30.
Good chest rise. Good chest rise. So while doing CPR, we want to have a good rate at 100 beats per minute. Good recoil and 1/3 of the chest compression.
27, 28, 29, 30.
Good chest rise. Good chest rise.
Stop CPR. Analyzing heart rhythm.
Okay, that was change.
Stay clear of patient. Shock advised. Deliver shock.
Don't touch the patient. Delivering shock.
The shock delivered.
Shock delivered. Carry on with CPR.
Start CPR.
27, 28, 29, 30. Good chest rise. Chest rise. Twenty-seven, 28, 29, 30.